This section will cover the basics on vaccinations, lice and worms. Some producers who have low numbers of goats, have really good nutrition and a low environmental bacterial load, or who are organic, may decide not to vaccinate. If you do vaccinate, the main diseases you are vaccinating against are tetanus, enterotoxemia and cheesy gland. Goats are unusual in that they require 6 monthly vaccinations compared to sheep and cattle who are only vaccinated annually. It is recommended to try and vaccinate your pregnant does at least 6 weeks prior to kidding, as this boosts her immune system and gives the cells in the mammary gland time to change to produce the best possible colostrum for her kids. What this means is that the kids develop immunity via the colostrum until they get their first vaccination at marking. Then the most important vaccination for the kids is the second booster, as this is where their immunity system goes, I've seen you before, I know how to fight you, and develops the longer-term immunity. Once a vaccine pouch has been breached, most manufacturers have stated on the box that if it is drawn up aseptically, to discard it after 30 days. It may seem like a waste of product if you only have a few goats, but in the long run, it is very cheap insurance compared to losing an animal. With people who have small numbers of goats, I usually recommend approaching your vet to see if they can dispense it, or get them to put you in touch with other local goat owners and to share the cost and labour with vaccination and pedicure days. Some vaccines have a requirement where the vaccines are to be placed subcutaneously, as in Guedere, which is a vaccine against Johne's disease. With Guedere, you also need to apply a tag with a V and a circle at the time of vaccination to identify those animals that have been vaccinated. With your clostridial vaccinations, as long as you choose a consistent spot that is not going to restrict movement or eating, so that if you do get an abscess, you know that it is a sterile vaccine abscess, or that you have accidentally nicked the muscle or dirt was introduced with the needle, rather than a weed seed or some other skin puncture causing an abscess. Whilst there are no withholding periods with most vaccines, you do need to record its use in your veterinary chemical register. I would also mark on your calendar, you do need to record its use in your veterinary chemical register. I would also mark on your calendar when they are due for their 6-monthly booster, so that it is not overlooked and you can make sure you can get the product and the volume you want prior to the day. With lice, there are 2 main types of lice seen in goats in Victoria. A rounded-headed chewing louse that causes the goat to itch and rub against trees, fences and other structures, and a pointy-headed blood-sucking louse, which can cause anaemia and ill thrift. You can tell the difference between them by their head shape, how active they are when exposed to sunlight, or if you squish one between your fingernails and you get blood. The photo on the slide shows 2 blood-sucking lice at the front with a biting, chewing louse catching up the rear. Not many products are registered for use in goats, and those that are can have health risks for the person applying the product. You can get an off-label permit from your private vet for other products, but you need to observe the meat, fibre and milk withholding periods. You also need to consider what is called the wool rehandling period. As most louse products have been developed for sheep, this is the period between treatment and when an animal can be safely handled without the need for protective clothing. The other aspect to consider in the choice of product is whether it will have an effect on internal parasites. As with goat lice, you need to retreat within 10 to 14 days of the first application to kill the nymphs that have hatched from the eggs laid, and you don't want to encourage the development of drench resistance while treating for lice. And you need to have really good eyesight to see the lice sometimes when it's at small numbers, because with the photo on the screen, that little tiny animal in the red circle is the louse, and underneath that is an actual thumb. And you can see how small the louse is on the thumb. Worms, worms, worms. There is a fantastic website that has a lot of really useful information on worms and goes step by step through the different aspects of managing, controlling and treating for worms in your goats. This website is wormboss.com.au. There are worm drenches which are registered for use in goats, and drenches sold over the counter for sheep in Victoria can be used, but only at the stated label dose rates. One of the big issues is that most have a do not use in animals producing milk for human consumption label on them. A veterinarian's prescription is needed for using sheep worm drenches at higher doses in goats and to obtain the relevant meat and milk withholding periods. Your private vet can email Paraboss, the producers of the Worm Boss, Lice Boss and Fly Boss suite of tools, to get a booklet on worm control in goats, advice for Australian veterinarians, that explains the difference between what can or cannot be prescribed for goats and appropriate dose rates and withholding periods. Most states and territories allow vets to repackage small amounts of worm drenches into smaller sized containers suitable for backyard goats or small herds of goats. As long as repackaged and dispensed drenches are labelled correctly with the client name, dose rate and withholding periods. Product labels can also be downloaded from AVPMA's PubChris database, which is a website which lists all the veterinary chemicals that are registered or that have permits in Australia. First off, you need to know whether your goats do or do not have worms. As a goat scouring may or may not be worms. It could be a change in feed, it could be a protozoan infestation like coccidiosis, or it could be a bacterial infection like salmonellosis. Some producers do their own fecal floats at home, or take fresh faeces to their private vet for them to do an in-house fecal float. This is a great monitoring tool and will tell you whether you have low, medium or high number of eggs, but it won't differentiate between the important species as their eggs look similar under the microscope. The important aspect of a fecal egg count is the larval differential, which tells you the makeup of the worm population in the goats that you tested. Once you have determined what the species of worms are in the goats that you have tested, then you can start looking at what is the best product to use for your situation and what else you can do on your property to minimise larval contamination of your paddocks and improve the nutrition of your goats. Now, I've just seen that someone's just asked the question, do you need individual certificates for every off-label use of chemical? What I would do in that instance is develop an on-farm animal health plan program with your private vet. Go and talk to your vet, look at the potential products that you might be going to use in a 6 to 12 month period, and both you and he or she sign the document to say this is what you've arranged. So they've got a record of it and you've got a record that you keep with your veterinary chemical register. But understand that if anything changes, that it's best to consult with them. With worms, it is important to understand the life cycles of the worms you're dealing with. What daily temperatures and moisture levels are needed for eggs to hatch, and how long larvae will survive on your pastures with your ambient temperatures. Each property is different, with the worm population that is in the goats, and resistance to the various drench products available is different, as the worms have had exposure to different types and dosages of drenches. Doing the fecal egg count 10 to 14 days post-drench on the goats that you tested pre-drench will help you determine the effectiveness of the drench that you used by seeing how, hopefully, the fecal egg count has lowered. The efficacy of some drenches can be improved by withholding feed, as in bringing the goats in the night before into a holding yard so they empty out, ensuring that you provide water. But you've got to balance this off against the danger of inducing pregnancy toxemia or ketosis if the goats are heavily pregnant. Barber's pole worm is one of the nastier worms that's out there, and it causes anemia and bottle jaw. Now, FAMATRA is a way of assessing the level of anemia in goats, with animals with a score of 1 having a pink-red eye mucous membrane colour and not requiring treatment for hemoncosis, whereas goats with a score of 5 have white mucous membranes on the eye and require immediate treatment and probably intensive and palliative medical treatment. With properties whose worm population is developing drench resistance, there is a new product that has been recently released called biowormer. It is a natural fungus that, when fed daily to the goats, passes through the intestine and germinates in the manure. Then it traps, paralyses and consumes the emerging worm larvae. Whilst it does seem expensive in a larger herd, with the small herd that is being fed daily, it seems like it will be a great tool in breaking the worm parasite's life cycle. You're losing goats. What should you do? Talk to your neighbour. Your neighbour might have goats and have a similar issue. Someone in your district might have a similar issue. Definitely ring the vet. Ring the department, which is the Department of Economic Development, Jobs, Transport and Resources, also known as Agriculture Victoria, but definitely don't ignore it. You need to ensure that when you do need to euthanize a goat, it is done promptly, safely and humanely. From the standards and guidelines, it states that a person in charge of a goat suffering from severe distress, disease or injury that cannot be reasonably treated must ensure the goat is promptly killed. A person must only use the bleeding out by neck cut to kill a conscious goat when there is no firearm, captive bolt or lethal injection available. So even though it's not a nice thing to think about, it is something that you need to consider when you have livestock. If the unfortunate happened, how would you euthanize the animal and how then would you dispose of the carcass? If your livestock are suffering unusual signs or significant deaths, animal health staff can investigate, or we can approve your private vet to undertake what's called a significant disease investigation, with subsidised laboratory testing to determine what is happening on your property. It is better to find out why your goats are ill or dying and whether it is something that can easily be treated and prevented.